So we're immobilizing the spine, spinal immobilization of a seated patient. Procedure number 1, remember that is your actual skills test that we're going to use for your skills testing. So you have the answers to your skills tests. If you say procedure number 1, BSI Penman, you can elaborate on that. You captured 2 points already, right? All right. Then you have to delegate your partner to hold C-spine stabilization. So when you come over and you hold like this, it's not enough because it's not really stable. You have to anchor yourself to something so your arm should be against your body. Now I'm a lot more stable. He can't really move. Or anchor your, if it's a smaller patient, to the trap or something. Just don't let it out here. What's the tendency when you talk to this patient? They want to look, so you have to remind the patient, look straight forward, resist the urge to turn your head, okay? The KED is a splint. So before and after each splint, what do? PMSCs, pulse motor sensory cap refill. Bilaterally, upper extremities and lower extremities, both, okay? Bilateral means both sides. It doesn't necessarily mean at the same time. There's some that you can do at the same time, like pulse. Can you check pulse at the same time? Yes. Motor, can you wiggle your fingers? You can check at the same time. But be careful when you check, which finger am I holding? Thumb. Now you're like, which one? Can you feel both? You're asking twice. So which finger am I holding? Thumb. Which finger am I holding? Pointer finger. And then cap refill. You probably do that at the same time. Then you do lower extremities. Pulse motor cap, sensory cap refill. Don't forget pedo pulse. We'll ask you about where it's at, know where it's at. The easiest way is just check on yourself or somebody else and just practice that, okay? Okay, so the next thing you want to do is you want to do a rapid trauma assessment on everything that you're going to pretty much cover up. So the KED will cover up all the way from the neck, all the way to here. We're going to use a C-collar, so it's going to cover up part of the head. So you want to do a rapid trauma from the head all the way to the abdomen. Now on the skill sheet it says refer to your trauma assessment for rapid trauma, right? So now you have to know your rapid trauma assessment that you've learned to do the head. Expose and observe the head for DCAP BLS. I'm going to palpate for injuries, check my glove for blood, and then move on to the neck, anterior and posterior. What am I checking for the front? 5 things first. Stoma, medical alert tag, JVD, tracheal deviation, subcutaneous emphysema. And the posterior, what's that? I know there's always one in the class, I'm telling you.
Point tenderness.
On the back, step off and point tenderness, and then blood on the gloves. Okay. If you actually look at the next procedure, it says that you can apply the C-collar now or after, because there's a person holding this, so you can finish your rapid trauma if you want.
For the person holding the head, they're not the ones doing the palpating on the head, right?
No.
Someone else does it?
Somebody else does it. Yep. And you have to work with the person. The last squad had a question. If I'm holding the head, how am I going to palpate? Well, you can kind of butterfly up and then butterfly up, so you can do full palpation, if that makes sense.
Okay, so that is fine as long as you still have contact with the patient's
Yep.
head and you're holding it still?
Yes. So I'm holding it. I can kind of do this, and I can still keep hold of the patient, do this, and kind of keep hold of the patient, right? Then the chest, expose and observe for DCAP BLS. What 4 things are we looking for first? Second chest wound, flail segment, paradoxical movement, impaled objects. And then you want to palpate. What motion is this? Anterior to posterior on the sternum. What motion is this? Lateral to medial. Okay. And then one last thing on the chest, rapid trauma. What is it? Auscultate, lung sounds. Yes, capture those points, okay? Where am I going to auscultate?
I was right there, I was thinking.
Mid-axillary. Yeah, it's close. Auxiliary and axillary is close. Axillary line goes down the middle, right? Mid-axillary, right side, left side. Then expose and observe the abdomen for DCAP, BLS, evisceration, and palpate for distension, rigidity, guarding, pulsating masses, and rebound tenderness, and hot belly. Okay. All right, now you're ready to apply the C-collar. So you can do it again after the neck or do it after your rapid trauma flip this over. Don't forget how to measure, because we're going to ask you how we're going to measure angle of the jaw to the beginning of the trap. Okay. The black line to the bottom plastic piece. So remember to line up the C-collar straight and then apply the C-collar. I had last squad apply it crooked, noticed it, and then turned it. So once you turn it, it's a fail, immediate fail. So if you notice you applied it crooked, you have to release it and then reapply it again. Okay. Tab down the sternum and then tab on the chin. Okay. All right. Now we're ready to lean the patient forward. So there's a couple of different methods. My partner's still holding stabilization, and this is a really good case where when the C-collar goes on, you have to kind of like butterfly up, right, to allow the C-collar to go on and then hold it back up. You can hold the center of the chest, center of the back with open hands, or you can kind of grab onto the chin, but this forearm needs to be straight down the sternum. So not like this straight down, open hand on the back. On the head person's count, 1, 2, 3, lean the patient forward just enough to allow the KED to slide back. This is forward. Now's a great opportunity to expose and observe the back. For DCAP BLS, palpate the back for 3 things. What are you palpating for? Point tenderness, step off.
Blood, no,
2 hours later. Spinal alignment, yes. Don't forget, capture those points. Step off, point tenderness, spinal alignment, all the way down, thoracic, lumbar. Check for a wallet, just like you would. This is kind of like the log roll, you're checking the back. Okay. All right, then you want to delegate your partner to get the KED ready. Not really much to do to get ready. It's just open it up and kind of lay everything out. Then you want to slide the KED behind the patient. All the way down. Make sure you keep track of the leg straps, because leg straps tend to kind of get caught under things, and you want to keep track of it, both leg straps. Okay. And then you want to put the flaps under the arms and then pull the entire device up as high as it goes onto the armpits. Make sure it's centered. This is a great time to center it so it's not applied crooked. So the opening should be centered on the chest. Now we get to apply the straps. It's going to be the bottom strap, middle, top, legs, and then the head. Bottom, middle, top, legs, head. So apply the bottom strap. You can get this kind of prepped. And then don't pull it, because if you pull it, you're going to apply torsion this way. So it's a feed and pull. So you're applying even pressure and you cinch it snug. Okay. Bottom, middle, top, legs, head. This one, you want to keep a little looser so the patient can still breathe. We're going to tighten it just before the move to the backboard. Bottom, middle, top, legs. So now I kept track of my leg straps. It's going to come down this way. Make sure it's flat against the back and not twisted. So you want to feel with your hands to make sure it's flat. And it's going to go underneath the butt. I'm just going to raise this up. Don't do that in real life. Some people could do that. This goes underneath the legs right here. You could have the patient kind of assist you in kind of moving the legs up. And this is hard plastic. Human's going to have some fleshy give to it. We're worried about protecting the spine so the legs can move a little bit. So have the patient move the legs up. Make sure it's flat against the butt. along the back. And then feed and pull nice and tight, okay? And this right here, if you look, it's gonna be right underneath the butt. Don't do it this way, straight underneath.
Is there still a partner holding stabilization right now?
Yes. For testing, you're going to do it by yourself, just like I'm doing now. So you're going to be doing a lot of explaining. Yep. These you could actually clean up as you're strapping. If you have enough people, you could actually clean this up by rolling this up. Just doing this number. But you don't want to delay patient care. So if you have extra help, that's the kind of things that you guys can be doing, if that makes sense. Yeah.
These are one-time use things, right?
The KED, yes. That's why your healthcare is very expensive. So the head portion is going to be tough to do by yourself. This is the forehead strap. This is the chin strap. It doesn't really matter which you do first. But remember, in real life, you do it at the same time because your partner's going to be here. You're going to come over to the side. And you're going to apply it at the same time, 45-degree angle up. Okay. Because if you apply one side first, it's going to torque. So 45-degree angle down. So now we did bottom, middle, top, legs, and the head. Okay. We applied the straps just before the move. You want to have the patient take a deep breath, tighten the top snug, and then we have to do PMSCs because we just applied a splint. PMSCs, bilaterally, upper extremities, lower extremities. Okay. All you have to do is just verbalize that. And then we're going to move the patient over to the backboard. There's a strap on the side right here. So you're going to grab the strap and then your arm under the leg method, right on the thigh, just above the leg, and then you're going to pick the patient up, one person on each side. If this guy is 220 pounds, how much are you lifting up? 110 pounds. So kind of do a self-check. Your guy is 250, that's 125 pounds. So think about it just like we did with the stair chair. Don't just like pick them up and say, all right, what are we doing? So kind of think about it on both sides. How are you going to move this patient over to the backboard, right? So it'd probably be easier if we do it this way, and I'll show you why. All right, so I need 2 volunteers, 1 on each side. All right, grab the strap, top strap, there you go. Arm under the leg move, okay. 1, 2, 3, there you go. And then you want to crab walk. Go this way, come over my way. So you don't trip, and then back down. 1, 2, 3, lay the patient down. Keep the legs up, okay. Undo the leg buckles because it's strapped in. Now lower the legs and then loosen the top strap so the patient can breathe. And there you go. And then you backboard the patient using the backboarding straps and you check PMSCs. Now there is I don't see the cushion, there's the cushion. On one of the procedures on your skill sheet, it says delegate your partner to fill the voids. This is only if necessary. It's for someone that has a lot of space, like kyphosis or something like that. People walk around with a hunchback. It's called kyphosis. You may need to use the pads. So for the testing purposes, to capture those 2 points, you're just going to say, I'm going to delegate my partner to fill the voids if needed.